So today, on behalf of the study team, I'm going to be presenting our qualitative research on hepatitis C self-testing among people with experiencing corrections. This is qualitative research, and the methodology that I'll explain in a bit requires me to situate myself in the research. And just like Brian said, I am a Kool-Aid nurse. I run an internationally award-winning hepatitis C treatment program that includes a peer program, as well as the last 2 years of developed hepatitis C treatment and testing program in a local jail with connection to primary care upon release. So I actually have firsthand experience working in provincial corrections and seeing the barriers that exist there. These are my disclosures. So the World Health Organization identified hepatitis C self-testing as a priority to achieve global hepatitis C elimination goals. However, this recommendation was based solely on HIV self-testing programs. Increased HCV screening that promotes autonomy was strongly recommended, and that came from the Canadian blueprints that have been published. However, the evidence on HCV self-testing remains limited. Self-testing has the potential to reach high-risk populations, and there's a lack of understanding about optimal implementation strategies. Self-testing can be an opportunity to provide confidential, stigma-free, and low-barrier testing. So these are the methods and the design of the study. At present, current data suggests that 11% of people who have been incarcerated have been infected with hepatitis C, and 3% are chronically infected. And we know HCV testing rates in provincial corrections is low. Step one of our research process was a community consultation with PASAN. PASAN is a community-based harm reduction organization that works with people that are incarcerated or have been incarcerated in regards to harm reduction, HIV, and hepatitis C. A total of 15 qualitative interviews were done, and participant recruitment was done in partnership with PASAN. We used an interpretive description methodology. If you're not familiar with interpretive description, it's a methodology that uses tenets of phenomenology and grounded theory, but interpretive description also allows applied health disciplines to use their disciplinary knowledge. You can see the eligibility criteria there, and these were the themes of the interviews. So the themes came from a meeting with myself and nurse scientists and nurse researchers that went over the data together. And the themes are authentic representation, words carry power, altruism, stigma, and duality in the prison system, distrust of society, system, and self, and then easy, easy, easy. So as part of the interview, participants were shown a basic Hep C self-testing flyer that you can see in the corner there, and the National Comprehensive HIV Self-Testing website, which is called readytoknowresults.ca. Participants felt that to encourage people that have experience in corrections, that the images on the poster needed to be authentic pictures of people that have actually been in corrections or pictures of prison art. The slides show the flyer that study participants give their feedback on the comment designs and wordings for advertising for the HCV self-testing kits. However, the participants felt that the word free and that the kits were free needed more emphasis. They also suggested using a QR code and the QR code linking from the flyer to like a website that explained more information about HCV self-testing. The participants emphasized the need for relatable images, and I quote, "If the flyer is geared towards people who have been in prison, then put real pictures of people who have been in prison or put jail art on there. That way I will know the poster is for me." The participants produced a bunch of great flyer headings, which I'll let you read. They're listed on the slide. And in line with altruism, which is one of the main themes of the interviews, many of the participants developed slogans for the flyer that involve testing for the people around you. Or as one participant added, "You've gotten free from jail, you want to get free from this as well. It's easy now." For advertising and to reach people with experience in corrections, the participants felt that the flyers should actually be on the bus or on the subway, or at the bus and the subway stops, as well as hung in windows of community-based organizations that work with people with experience in corrections. So altruism, duality, and stigma. So a prominent theme emerged around altruism and altruistic timing for self-testing. Many participants were motivated to use self-testing kits by the desire to protect their partners, family members, and others from potential HCV exposure. Altruism led to a strong preference for receiving the self-testing kits upon release from correctional facilities. The theme of duality emerged in the interviews, reflecting the conflicting emotions between the desire of the autonomy to test by themselves, but also the desire to want support from someone else to do the test with them, as well as the fear of getting a negative result, the fear of getting a positive result, and also just the fear of not knowing what the result was going to be. And then the fear of waiting for the result to come back, and also, if depending on what the result meant, the fear of having to disclose that result. Stigma was also seen as a theme, which was expressed by experience of public stigma, self-stigma, and structural stigma. A participant shared their experience by stating, "A lot of people don't want to know the effing answer to the test. I've had Hep C for I think it was 15 years, and because of the stigma in that, I went to a few places, the way I got treated, so I just said F it. You know what I mean? You're asking people to go through that." So distrust of society, system, and self. Distrust of the society, system, and self was predominant in all 15 interviews. When asked about receiving results, a participant stated that cracking people's emails was easy and you must actually see the file to know that result is yours. Another participant, when asked about willingness to submit a dry blood spot, talked about how dry blood spot testing could be seen as collecting DNA. A participant stated self-testing was a good idea because you can't trust the system or the people, but you can trust the result that you did yourself. When asked about HCV self-testing, a participant stated, "Because there's many things that could go wrong, I'm sure I would get the directions and they would be clear as they possibly could, but the way I might read it might be different from the way it's explained. I would probably be reading it over and over and over again and probably get nervous to do it the more I read it, right? Because things of this important are very delicate, so I think I'd probably want to go to my physician." The preferred methods of receiving an HCV self-testing kit, it spoke to the theme of easy, 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 as things need to be really easy. Participants expressed a strong interest in HCV self-testing, citing it as a solution to overcoming barriers they face in assessing traditional testing. The timing of receiving a self-test was seen as crucial and highly individualized, with the consensus being that the best moment is when the person feels ready to test and prepared for the results. Although most participants agreed that the window period after release was when people were motivated to test. As one participant aptly put it, "If I walk out with a test kit, I might walk out and test myself right now because I'm out here right now. But if we walk out and think about testing in 2 months down the road, I'm probably involved with a whole bunch of other stuff. So you really want to utilize that window, that very little window." Other ideas for kit distribution sites included places where people with corrections frequented, like probation or parole offices, pharmacies, and making the process easy, easy, easy. As with all studies, this study had strengths and limitations. I think one of the strengths was the co-design. I think qualitative research has obviously strengths in stating participants' experiences. Its pragmatic results with actionable outcomes. I hope to demonstrate that in the next 2 slides. Interpretive description comes from a place that's pragmatic and that can form clinical practice. And with all qualitative research, it has limited generalizability, potential for social desirability bias from participants, as well as research bias. So this is a summary of Hep C self-testing workflow. The research findings helped us understand the logistics and led to the development of the self-testing workflow, which can be used clinically and to roll out HCV self-testing. Most participants were willing to do non-mandatory reporting on a portal. And overall, participants had no issue with doing their self-finger prick poke themselves, making dried blood spot testing as well as rapid testing feasible. Participants did prefer to mail their results or hand them in directly to an organization. If they wanted to mail their results, they wanted the envelope to have a stamp on it and within a return address, which makes sense. But receiving results was acceptable via text, email, phone call, or in person, but participants really wanted to choose the option that worked best for them. Overall, HCV self-testing was well received by people who have experience in the correctional system, and there's a window period post-release where people felt that would be most useful. A few participants suggested upon release from corrections that they should receive a release bag. For example, and I quote, "So in that release bag, it should come with an HIV test kit, a Hep C test kit, condoms, tampons, pads, underwear, whatever. Those are the essential things that you would want because you want to make sure that you're safe as an individual." I think our study highlighted that people are most likely to undergo HCV self-testing out of concern for others. Peer support should be involved in helping with HCV self-testing when available, and that finger prick test through blood was totally acceptable. However, as we all know, self-testing needs to be followed by linkage to appropriate post-test care services, including confirmation of infection, treatment, care, and other referral services. I think some of the insights of this program can help inform programs in the future. And I'd like to acknowledge and thank the research team, but most of all the participants who shared their time, expertise, and experience with us. Thank you.
Thank you very much. We can take 2 questions. Oh, sorry. Yes, up here.
This was really awesome, Tamara. Well done.
Thank you.
So after the rollout of the HIV self-test, my perception from like lab public health side is that we sense that we're not seeing improved linkage to care from people who are utilising the HIV self-tests. Mm-hmm. And this is resulting in a decreased appetite to fund and support HIV self-tests. So how do you think that this Hep C self-testing kind of potential might be received and by the people who are likely to have to pay for it? Yeah. And how can you emphasize through what you've learnt from these participants that there are ways that this could lead to improved linkage to care?
Yeah, I do actually think this can lead to improved linkage to care. I think we always underestimate the power of stigma, and to actually go into a clinician's office and ask to have a Hep C test is really, really difficult. I think in my own practice, and related to the HIV self-testing program that you're having, those testing kits fly off the shelf. And when I ask patients what they do with them, sometimes they're not using them for themselves. They're actually bringing them to their other partners. And so I think that this is a way for people within the community that need to be tested for hepatitis C to grab kits and then test their social sharing networks. I also think there's power in knowing your result, but then sitting with that for a while, which sometimes our patients do. They know that they're positive, and maybe they've never been positive before. I know antibody testing is complicated because you have to get an RNA, but just to know that and then think about whenever you're ready to go and do something with that. And that might even be looking online to figure out which clinic you should go to so that you don't have the experience that I shared with one of the participants that waited 15 years. So I do think that there is a place for it. Lots of things happen. As I've worked in corrections, lots of things happen that we don't tend to talk about. And so I was not surprised when people would actually do self-testing kits when they left. Mm-hmm.
Okay, well, I'd like to thank all the presenters.